Hi, I'm Willoughby Britton, and I'd like to talk about signs of dissociation. I don't think as meditators and meditation teachers, we really get taught enough about dissociation because it's a really common experience in meditation, and it's not necessarily something that we want to cultivate. But I know for myself, I did for decades without even knowing what it was, and it took, even after having 10 years of clinical training and a PhD and a postdoc, it wasn't until I went through trauma training that I actually knew that a lot of what I'd been doing in meditation was actually dissociating. So here's a little run through of some of the signs of dissociation. So in the somatic domain, so in terms of your body, you might see flaccid muscle tone, like a feeling of weakness. The one that's really easy to see as a teacher is that if somebody's extremely still, like they look like they're frozen, or if it's you, you feel like you're frozen, like you just are like almost locked into a certain posture, like almost like you're paralyzed. Pale skin tone is another indicator. If somebody looks kind of gray, that's a sort of indicator, especially if their skin changes from pink to gray. That's a sign that they've just gone from hyperarousal into a dissociated state. The fixed gaze or the 1,000-yard stare or glassy eyes. So often we tend to look like in a specific, we lock our eyes onto an object in the environment. And that alone is actually enough with the still body to kind of induce a freeze state, a dissociative state. So sometimes just moving your eyes a little bit can get you out of that. In terms of the cognitive domain, when we get really concentrated, we can induce a dissociation where we start to have no thoughts at all, which is called mind emptiness. We can also lose our ability to form concepts. And so one of the examples that I often use, which a meditator told me, was after a retreat. She was driving home, and she was actually behind another car, and she got to a red light and the other car stopped, but she actually didn't know whether red meant stop or go. So you can see how that could get pretty dangerous pretty quickly with the case of the red light. So concept loss is another sign that you're sort of losing some of your cognitive function. When you're doing an interview with somebody, you might notice that they're very slow to respond. Like you ask them a question and like many seconds go by before they answer. They might seem a little disoriented, like they're not sure where they are, or they just look very like they don't really know what's going on. Also executive dysfunction, which is like problems making decisions, like what do you want to do now? I don't know. Trying to plan something is just like there's no way that you can plan, a day or a trip or whatever. Remembering things, working memory, just offline. Similarly, you might see slow speech in addition to the delay in responding. Just speech might slow down a lot or even be slurred or somewhat disorganized. People might describe their state as being spacey. They might feel ungrounded, or they might feel like they're floating or floaty. So those are some words to look out for. There's also a very common change in time perception, which past and future just disappear. That's related to the inability to have concepts. And there's sort of a hyper nowness. So there's just like the moment of existence is a very small window. And people can be like, what are we talking about right now? Like what was the beginning of this conversation? I don't even remember. So that's how small the window of nowness can be. Okay, so dissociation tends to often be described, primarily as a disturbance in selfhood. So when you're profoundly dissociated, you might feel like you don't exist at all. Some people ask, can you see me? Can you see me right now? Or you can ask someone, do you feel like people can see you on the street? People often keep checking in mirrors to make sure that they are still there. A little less extreme is just feeling like you're there, but that you're somehow outside of your body or somehow at a distance. So it might be subtle. It might be like if you feel further back in your own head or slightly like off to the side or just like somehow more distant than usual, like not just right behind your eyes like you usually are, but just some other location. Or there just might be a vague sense of disconnection from your own body, from your own emotions, from your own thoughts. And that can play out in terms of not feeling like the ownership of those body emotions and thoughts is yours. So people might feel like, well, I have emotions, but they don't feel like mine. Or I can feel my body, but it doesn't feel like mine. Things like that. There's that when that comes to action, loss of ownership over action is called loss of agency. And so people can feel like their movements are just happening on their own. There's no one, there's no director, there's no author or center or agent that's moving the body. There's no me that's moving the body. The body is moving on its own or even being moved by an external force. And so often you hear, even in Buddhist texts, metaphors, like in Buddhist texts, you use the metaphor of the marionette. A lot of people use metaphors, a puppet or a robot. So that's other words to look out for. In terms of emotion, if you understand the neurobiology of dissociation, your prefrontal cortex is sort of suppressing the limbic system and the autonomic nervous system, and that will result in affective blunting. So a loss of emotions, both positive and negative. Like I said, people will say I have emotions, like that they will have normal, their expressions won't be blunted. So it's a disconnection between having the emotion and feeling the emotion. So from the outside, they look normal. They have normal prosody in their voice. They have normal expressions. They cry, but they'll report that they don't feel their emotions, or again, they don't feel like mine. This might also just extend beyond just emotions and feel like just apathy or feeling dead or like nothing matters. It can look like depression, but it's different. And like just feeling like a lack of meaning or motivation, watching people walk by on the street and being like, I have no idea why they're doing that. Like, why would you go anywhere? Why would you do anything? And that's all because of the limbic system being turned down dramatically. So in the perceptual world, when the limbic system gets turned down, it has a very interesting effect on perception. And that we don't really realize how much our emotions are coloring everything. And so the feeling of familiarity of like my office, of my voice, of everything is actually an emotion. The feeling of mindness is an emotion. And so when that's absent, the things inside me, like my voice and my emotions and my body, they all seem foreign. Or I seem like they're not mine, or like I feel disconnected from them, because that's a limbic system emotional thing. And that same process applies to perception, where things that normally seem familiar seem unfamiliar. And so it adds this weird dreamlike quality or unreality feeling, where everything just feels off. And it can be very frightening if you're not expecting it, which is why I'm telling you this, because this is what's happening. And there's nothing wrong with you. You're not broken. It's not permanent. It's just, basically an adaptive defense response against, acute stress, that your attention system basically shuts down your limbic system temporarily to protect you from intense fear. And so that's why everything looks weird, but it's just a sort of temporary side effect. So other things that can happen are that objects can appear oddly flat, two-dimensional, but also hyper three-dimensional, where TVs look like you could walk into them. People can seem cartoon-like, or just weirdly unreal, like they're maybe they're kind of made of clay or something. There's a strange distortion in distances, like when you look in the mirror and it says like objects are closer than they appear, like that. It's like things can seem further away than they are. Just everything's a little off, like the sort of fishbowl feeling. In terms of visual acuity, it can go either way. Like it can be like you can see every leaf and every vein on every leaf on a tree, like as if somebody said once, like getting a new contact lens prescription and suddenly everything's like, wow, so clear. It can be like that, or it can be the opposite, almost like the world is full of fog and you can't see anything. It's kind of foggy. So it can go either way. There can also be a feeling of, especially socially, like there's a pane of glass between you and the rest of the world. Like there's this weird disconnection, almost like, you know, you're kind of talking, but like nobody can see you, like almost like feeling like a ghost. So that brings me to the social and occupational system. Because of this, it can feel really, really disconnecting because it's such a weird experience. It's really hard to share with people. And so a lot of times people who are dissociated don't tell anyone because it's so weird. It sounds, often they get misdiagnosed as being psychotic. In fact, it takes, on average, a person who's depersonalized or dissociated, it takes them 12 years to get a correct diagnosis because there's such poor training in the clinical world. And it's just a very unknown thing, even though it's not actually that uncommon. So there tends to be a lot of social withdrawal and avoidance because of that. But also the nature of dissociation is often caused by there not being a reliable resource in terms of interpersonal support. And so it's kind of often the social engagement system is offline. And so you might also notice that if somebody is unable to make eye contact with you in class or in an interview, that can also be a sign of dissociation. So one of the things that's been, I'll just pause for a second. One of the things that's been my big question is, how do you tell the difference between meditative calm and dissociation? There are a lot of overlaps in the neurobiology. So, you know, both depersonalization types of dissociation and, you know, mindfulness meditation are both associated with, you know, a very active prefrontal cortex and the downregulation of the limbic system, the amygdala, the autonomic nervous system, the increase in the parasympathetic nervous system. So you're seeing a ton of overlap between these two things. And I mean, there's a lot of speculation that they're in fact the same thing. But I think that one way to differentiate them is to ask somebody, do you feel more connected or disconnected? And if the more dissociated kind of calm, they feel more disconnected, they feel like they're not here. And they tend to be, like I said, more frozen and immobile. Another indicator is when there's a sudden resolution of distress. So they might be having a very hard time, a lot of negative emotions and stress, and then they go from that, you know, they're sweating, their face is pink, and then suddenly they're like, I don't know, I feel fine. I can't reach it anymore. It's gone. There's nothing going on. So that's another indicator that the system basically just got overwhelmed and it sort of flipped. There's a flip where the prefrontal cortex just shuts everything down. And so that's another kind of good indicator. And also the social engagement system. So I like to ask people, you know, look around and like, tell me what you see. And if they start naming inanimate objects, like, oh, I see a meditation cushion, I see, you know, a plant, a computer, a book, you know, and there's like a whole room full of people and they're not naming them, that's a pretty good indicator that their social engagement system is offline and they're dissociated. And when they come back online in their face, you'll see it in their body. Their body will start moving a little more. Their face gets pink. They'll describe that their body's getting warmer, and they'll start making eye contact, and you'll feel it. Like they feel like they're here, and they'll say, "Yeah, I feel like I'm here. Oh, I see Mary. I see all these other people." They start noticing other people. So anyway, that's my I don't know, 10-minute spiel on dissociation, and hopefully that gives you a little bit more sense of what it feels like and what it looks like if you're a teacher, to check it out.